This is the Emergency Medical Minute.
So in case you guys don't know this, and there's been an outbreak in Oregon of measles. It's now in the mid to high 30s. It'll go up. We had one here, not at Swedish, but at in the city, who went to King Soopers, an urgent care, I think a freestanding ED, then a regular ED, and got a massage. Yeah, so spread this all over. So it is extraordinarily contagious. It's more contagious than the flu. So if you're in the vicinity of somebody who's sneezing and coughing and you are not vaccinated, then your chances of getting it are pretty high. So measles is the easiest disease to remember all the stuff, though, I think, because it's 4 and 4, 14, and a bunch of C's. So you're contagious 4 days before the rash, 4 days after the rash. It can take 14 days for you to get the rash from the time that you were exposed. And then the C's. Does anybody know what the C's are?
Cough.
Yes.
Congestion.
Yeah, but what is the fancy word for congestion that nobody ever uses ever except for this? Coryza, yes. So cough, coryza, what else? One more C.
What's the second letter? Rash.
C-O.
Cough?
We said cough, coryza, conjunctivitis. And it's a non-purulent conjunctivitis. So their eyes are red and they look like they should be stuck together, but they're not. And then the other one, which is not a C, but kind of is Koplik spots. Have you guys know what Koplik spots are? Yeah, they're these little white spots in the mouth, and they kind of look like, I think they look like white petechiae. They're kind of tiny little white spots, and they're usually kind of flat. They don't have that ulcerated look like aphthous ulcers look. So if you see somebody that looks like that, besides that, they look like stink. Okay, I've seen it. When I was an intern, I exposed the entire ER in Denver Health and the ICU, the Peds ICU, with my senior resident because the patient we saw was the index case for an outbreak. They look horrible. They will have SIRS criteria. These aren't smiley, happy kids that you know give them a popsicle and they're playing with you. These people look like dump. The risk factors with it, about 1 in 1,000 people will die from it. The highest risk groups are those under 2 and those over 20. So you don't have to be old, you just have to be not a teenager. And then the worst thing is subacute sclerosing panencephalitis, which can occur 7 to 10 years after their measles infection. And that's an irreversible, progressive, degenerative brain disease that's 100% fatal. So it's not anything to mess about. Tell your bolder friends to get vaccinated.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.